Hi guys, Dr.H here, your source of musculoskeletal care. And if you're a patient of mine, or if you know me, you know I love football. And if you've been watching the NFL this year, you know there's been a ton of injuries. One of the most common injuries we're seeing is hamstring strains. Why is it that these elite, incredibly strong athletes are getting so many injuries, particularly these soft tissue injuries like hamstring strains? Well, let's talk about that. All right, so let's start with the basics. What are the hamstrings? The hamstrings refer to a group of muscles. There's actually 3 muscles on the back of your thigh that are collectively known as the hamstrings. You have 2 of them that are on the back of the thigh towards the middle of the body, and you have 1 of them that's on the back of the thigh more towards the outside of the body. They originate from your pelvis, your bony pelvis, specifically the part of the pelvis that you sit on. And they travel down the back of your leg and connect to your shin bones, or the 2 bones that are in your lower leg there, your tibia and your fibula. This is actually kind of important, and we'll talk about why a little bit later. But one of the most important things to note here is that it crosses 2 different joints, right? So at the top, where it's going from the pelvis and down, it crosses the hip joint. And before it inserts down into the tibia and fibula, it crosses your knee joint. So whenever you have a muscle that crosses 2 different joints, that muscle is going to act on both joints. So what do the hamstrings do? Well, at the knee area, they're responsible for flexing the knee, so bending your knee essentially. At the hip area, they're responsible for extending the hip, so making your thigh go backwards essentially. Now here's the important thing. When it comes to flexing the knee or bending the knee, really the hamstrings are your primary muscles to do that action. There aren't really any other muscles that are primary knee flexors, at least not anywhere near to the extent that the hamstrings are. So that's all well and good, but what about extending the hip? Well, really, the hamstring shouldn't be your primary muscle that's extending the hip. They absolutely contribute, and they are a major muscle involved in hip extension. But for that, we want to talk about another muscle, gluteus maximus. Gluteus maximus, sometimes is collectively called your glute, is this giant muscle that kind of makes the shape of your buttock. It attaches from the top of your bony pelvis, across the hip joint, and into the upper part of your big thigh bone, your femur. It only crosses 1 joint, so it only acts on that joint, which is the hip joint. And it is your primary and dominant, or at least it should be, extensor of the hip. It's a very powerful muscle, if not one of the most powerful muscles you have in your body. So where we can get into trouble is when your hamstring muscles are doing the primary work for hip extension as opposed to your gluteus maximus muscle. Again, hamstrings absolutely need to contribute to hip extension. I'm not saying they shouldn't. I'm just saying that it should be a secondary muscle. It shouldn't be the first to fire, and it shouldn't be the one that's firing the hardest. In the case of individuals who suffer from a lot of hamstring strains, that tends to be the aberrant motor pattern. That tends to be the problem. During hip extension, it's the hamstring that's firing first and most dominantly, as opposed to the gluteus maximus. Now, a real quick disclaimer. Obviously, I haven't examined or worked with the current players in the NFL. I'm not saying this is exactly the reason why they're getting these hamstring injuries. However, I will say that it is a lot less common for a hamstring to be perfectly healthy and then get strained. Usually it's a pattern of overuse, where the hamstring is becoming more and more disorganized at the tendon and the muscle over time because of misuse or overuse, until at one point you sprint or jump or something, and it's sort of the straw that breaks the camel's back. That disorganization finally fails and you get a hamstring strain, or worse yet, a frank tear. So let's go back to this incorrect firing pattern, or this incorrect motor pattern, where the hamstring is taking over for hip extension, wherein it should be relying more heavily on the gluteus maximus, or your glute muscle. This causes a few problems. One, we already mentioned, the hamstring crosses 2 joints and is responsible for 2 primary actions, knee flexion and hip extension. If it's the primary mover for both of those actions, obviously it's going to be more susceptible to overuse. If it's not getting any help from other muscles and it's doing all the work, it's going to take most of the strain. Whereas if you look at leverage and muscle type, your gluteus maximus is a very thick and short muscle. It can take a lot of strain to produce a lot of power. Your hamstring muscles, all 3 of them, are kind of the same, which is very, very long, relatively thin compared to something like the glute maximus, and therefore more susceptible to overuse and strain. So overworking it is definitely an issue, but there's a more complicated issue, and for that it requires looking at sort of the lever arm or the moment arm caused by these 2 different muscles. So because the gluteus maximus arises from the top of your pelvis and inserts toward the top of your femur and goes a very short distance, it has a lot of control over the head of that femur, which is what inserts into the hip. Your hip is part of your pelvis and part of the head of the femur inserted together. And you have a muscle kind of right here near the head that's helping to stabilize that joint. The hamstrings, on the other hand, with the exception of one small part a little further down, for the most part don't touch the femur. They go from the pelvis to the tibia or fibula, bypassing the femur altogether. And so when you're shortening those muscles, there's not much stability being given to the femur. This causes a host of problems, one of the most predominant of which it allows the head of that femur to slide forward in that socket. Now you have a very, very, very strong capsule around that head of the femur that prevents any kind of dislocation from occurring. But it does mean the femoral head is constantly bumping up against that hip capsule. And this can cause groin pain, which is sometimes diagnosed as groin strains, which is another very frequent injury you see, particularly this year, amongst high-level athletes such as NFL football players. So how do we get in this situation? How do we get this problem where our glute isn't activating as well as our hamstrings? Well, for the majority of my own patients, it's posture and inactivity. It's a lot of sitting, in other words. When you sit for long periods of time, you are increasing inhibition of that gluteus maximus. You also cause the hip flexors to get tight for the same reason. Now, in athletes, you can have tight hip flexors, and it's actually pretty common. It's for different reasons, obviously, than inactivity and poor posture. But when you get tightness in the hip flexors, meaning those muscles that go in front of your hip and allow you to bring your knee up to your chest, for example, you get what's called reciprocal inhibition of the glute maximus. So when you have two muscles that are doing two different things, so in the case of glute max, you're extending the hip. In the case of hip flexors, you're flexing the hip. Contraction and tightness of one of those muscles tends to cause inhibition of the other. It makes good sense. If you're trying to flex your hip, you don't need glute maximus contracting super hard to keep you from doing it, so your body shuts it down. Well, this can become a permanent motor pattern. So inactivity, poor posture, tight hip flexors, again, not usually what is causing this glute inhibition in athletes. Other things that can lead to this, though, is just overtraining this poor muscle pattern firing. The fact that this motor pattern has just been ingrained into the way they've been doing things and no one's corrected it. Motor pattern firing is not a conscious thing. It's not like you're doing an exercise, you think, okay, I'm going to contract this muscle, then I'm going to contract this muscle, then I'm going to contract this muscle, right? It's a neurological, not really a reflex, but a pattern. So what can happen then is once you kind of get ingrained into that firing pattern, even if you're doing exercises that are strengthening or targeting that glute max muscle, you're probably just going to be further ingraining that pattern. So take the squat or the deadlift, for example. Both of those are really good glute max exercises. They hit that area because they involved a lot of hip extension. But you're going to be able to do those exercises whether you're firing hamstring dominantly or glute max dominantly. And you're not going to know which one's probably doing it. A good example is a study that was done showing that there was a twofold decrease in glute activation during the squat in people who had this motor pattern that was disorderly. However, there was no decrease in strength in the glute maximus during a isolated exercise like prone hip extension. What that says is it's not a problem that the glute maximus is weak. I mean, there's not a single muscle that's weak on these NFL players, I can promise you that. It's a problem of incorrect motor pattern firing. And so even when you try to strengthen the glute, if you're not correcting that firing pattern, if you're not correcting that overdominance of the hamstring, it's just going to help re-ingrain that pattern. So unless you're being trained to fire that glute max and really concentrate on it when you're doing your lift, you're just going to keep doing the same motor pattern you've been doing probably for years at this point. How you initially fall into that motor pattern is hard to say. There are a lot of different contributing factors, one of which could be overtraining of the hamstrings, so doing a lot of hamstring isolated exercises like the hamstring curl. Maybe you've overtrained the hamstrings and now they're just sort of taking over, or maybe it's the other way around, whereas your glute maximus has weakened to the point where your hamstrings have to take over. One common cause of that, which is very, very common in pretty much every athlete, is ankle injuries. So they've done studies showing that chronic ankle sprains lead to inhibition of the glute max, on both sides, not even just the side that you sprain the ankle on, but on both sides. And if those aren't properly rehabilitated, you're going to get sort of this chronic inhibition of glute max, and therefore this disordered firing pattern. All right, so we talked about this problem, and this may or may not be the problem with these NFL athletes, but it certainly is a major problem amongst my patient group. So once you find out that you have this problem, what do you do to fix it? It's pretty complicated, and it kind of depends on what caused it. If it's a posture or an inactivity thing, it might be as simple as just retraining the glute max, getting it a little bit stronger, a little bit more involved in these activities. If you're already an elite athlete and it's not that, then you have to look elsewhere. Is it just a motor pattern problem where you have to really work with them to get them to concentrate on firing that glute max during activity? And that can be a very long, arduous process. Is it due to an ankle injury in the past or a knee injury in the past and you have to rehab that properly? There are a large number of things that can contribute. Whether you're the NFL athlete or the weekend warrior, if you're suffering from chronic hamstring strains, you probably do need evaluated by a musculoskeletal specialist of some sort to figure out what might be going on and get to the root of that problem. All right, guys, so a little bit of a different video today, more commenting on what's going on outside of the clinic as opposed to trying to explain things that are going on inside the clinic. But I thought it would be a fun video to talk about, and I know, obviously elite athletes aren't the only ones who are suffering with chronic hamstring strains. This is a very common problem even for your weekend warriors. All right, guys, that's all I have for you today. In the meantime, keep moving.